welcome to this virtual pharmacy school fair workshop. I am Stephanie Madrigal from AACP, and I will be moderating this session today. And we'll go ahead and get started with today's session, which is Your Future in Pharmacy, Community Impact and Support Programs that Get You There. And we'll begin that in just a few moments. First, I want to go ahead and remind you of a few housekeeping items. Though you will be muted for the entirety of this webinar, please feel free to ask questions in the Q&A box. We have saved some time at the end of the presentation to address those questions. If there are any questions that we do not get to, the speakers will be available in their booth during the expo hours, which are this evening from 5 p.m. to 7 p.m. Eastern Standard Time. We highly encourage you to visit the booths at that time. Additionally, this presentation will be recorded and available immediately afterwards in the session tab in the fair. Now I'll go ahead and turn it over to our speakers to go get started.
Thank you so much, everyone, for joining today. I have the pleasure to get to speak to you today a little bit about not only pharmacy, but a little more emphasis in regards to community pharmacy and some of the support programs that Walgreens offers that can help get you on the path to obtaining your PharmD and pursuing a lifelong career in pharmacy. So as we kind of get started, I'd love to give you a little bit of background information about myself. So I have been a pharmacist with Walgreens since I graduated with my PharmD from St. John's in 2013. And I came on board in a traditional community pharmacist role. Then in 2016, I assumed the role of pharmacy manager. I will say taught me a lot about leadership skills and being able to really inspire and motivate teams. So I appreciated getting to develop that new skill set of really being able to shape my pharmacy and my staff and deliver community services to patients. Then in 2022, I had a little bit of a unique experience. I know when we think community pharmacy, we tend to think of that brick and mortar pharmacy. But I had the opportunity for 2 years to do a worksite pharmacy. Walgreens has a few of these across the country. Basically, they're a small profile Walgreens that's located in a closed client building. So the services and prescriptions that we're filling and front-end merchandise that we're selling are only for those clients' employees as well as their family members. We also have a partner company called Preface Health, which will actually have health centers on site. So I had the opportunity to work really closely with health center staff, which included physicians and nurses, and got to be part of a P&T committee that Premise had, where it was basically looking at how could we relay new information about newly approved drugs, also looking at what should be formulary for prescribers in the health centers. So really allowed me to focus on health outcomes for my patients and work really closely with our health center staff. Then in 2024, I had another unique opportunity where the company stood up a role where they were now placing pharmacists in talent acquisition. And what I get to do, the pleasure that I get to do, is actually engage with individuals who are interested in pursuing a pharmacy career and speaking about community pharmacy, what that kind of looks like, how it's constantly evolving, going out to schools and trying to inspire the next generation of pharmacists. So that is the role that I'm currently in today. And this gives you a little bit of a snapshot around my career and the opportunities that I've had to develop new skills within each role that really prepared me for my next position. And I will say, definitely kind of shows how if you're able to embrace that infinite mindset where you're constantly working a little bit harder each day to learn or grow a new skill set, how that continues to translate along your career. So what I love to speak about within my role is really how pharmacy is that patient-centered care. So we know pharmacy is one of the most accessible healthcare professionals Approximately 78% of Americans live within 5 miles of a pharmacy. So when we're thinking about care, especially in underserved areas, pharmacists are extremely accessible. So even patients that perhaps have issues with getting to a physician or potentially not having insurance, it's very easy to go into a pharmacy and speak to a pharmacist about their healthcare concerns. So really our pharmacies, community pharmacy in general, is really an entry point into our healthcare system, where maybe patients aren't seeing providers as frequently as we would like. Also, looking at pharmacy, really, as we kind of surveyed patients throughout the community setting, we know our pharmacists are one of the most trusted healthcare professionals. Um, Patients look to us and know that we are medication experts and that we're there to really connect with them and talk to them about questions that they may have. Really, this career in pharmacy is about patient relationships, being able to support them, being able to communicate with patients to understand their needs and concerns, and navigate through those healthcare changes that they're experiencing. Also, pharmacists help bridge a lot of healthcare gaps by being that accessible professional that they can go to help support them for chronic conditions or even acute ailments, even providing over the counter recommendations. And as we know, with a growing demand in primary care and also a decreased supply of primary care physicians, pharmacies and pharmacists are playing an even bigger role in supporting general public health. So, what are the core functions of pharmacists? And you may have been in another session that kind of dictated a little bit of information around this. So, we know pharmacists are really the medication experts. They're to ensure safety with medication use and making sure that patients are taking medications as they are prescribed and the best way to really improve their health. Sometimes there could be little tidbits of information with medications that patient doesn't know on how to best take a medication that can actually improve the efficacy of the medication in managing their chronic health conditions. Our pharmacists are also there in terms of being able to provide clear patient counseling. So I know as a pharmacist myself, the part of my job that I've always enjoyed the most is being able to take time out with patients, going over the medications, what to expect, when to take it, when they should be concerned. If they're experiencing an adverse effect, and when to reach out to the physician or pharmacist as well. A lot of what pharmacists do, additionally, is being able to collaborate with different partners along health teams. So this could be nurses, physicians, and other prescribers being able to kind of work together to look at patient care overall to identify potential gaps. Hey, maybe this patient's missing something in their chronic health care. So it's reaching out to that prescriber and saying, hey, did you know so and so was missing this? So there's a lot of collaboration, or when a medication's not covered, reaching out to prescribers. Pharmacists also play a massive role in terms of delivering preventative health services. So I think one of the great strides within pharmacy that has happened within the last couple of decades has been being able to administer preventative services like vaccines, being able to offer health testing. So whether it be flu testing, COVID testing, because we're so accessible, it allows patients to actually receive more care in certain areas because it's easier for them to kind of get into the pharmacy and, let's say, get their flu shot or get their tetanus shot than if they had to schedule an appointment with a prescriber, have a waiting period in order to get that. Also, as we kind of talked about being able to collaborate with prescribers and care teams. Really, pharmacists are there to support ongoing management of chronic conditions. And this is going to be across all areas of pharmacist practice, not just community, but you'll see that along hospital teams, clinical care teams, ambulatory care, where we're really there to help patients understand how they can better manage their conditions. So to kind of give a few highlights in terms of pharmacist pathways. So this is not all encompassing, and something that's fantastic about pursuing your pharmacy degree is that pharmacy is continuously evolving and there's new pathways for pharmacists in terms of kind of branching out career wise. So while we'll have pharmacists that kind of pursue the community pharmacy path, which like myself, can kind of branch into other pathways still within community pharmacy, but not that traditional brick and mortar pharmacy. There's also hospital pharmacy, where we have pharmacists helping verify orders from physicians within the hospital setting, so that patients, both inpatient or if they're getting discharged, get those medications. There'll also be pharmacists that are part of the clinical care teams in hospital settings, so they could be part of the emergency room, reviewing patient charts, making sure that there aren't med errors, or going out in terms of inpatient settings and going on rounds with physicians to kind of go over patient medication lists and support. We also see pharmacists going into ambulatory care, where we're looking at how do we really treat patients in more of a patient comes in, we kind of have that consultation and then continue on with their daily lives. But definitely a lot of pharmacists in a ambulatory care setting. An also growing sector has been specialty pharmacy. And specialty pharmacy is one where a lot of them tend to be medications that either have a high risk of adverse effects or high cost medications that it's really critical that are taken in a specific way to be fully effective. So this has been a growing area of opportunity for pharmacists as well. Then we have pharmacists who kind of go a little bit of a different route in terms of going into pharma, looking at drug industry, is sometimes looking at research and helping develop new drugs, or serving as a professional in terms of answering questions, whether they come in from patients or prescribers about medications for a drug company. We also have pharmacists that go into public health roles. How do we impact care within state legislation and even larger on a federal legislation? And then in terms of like non-traditional and emerging pathways, we even have pharmacists going into like informatics and looking at, okay, we'll have like electronic health systems, and how do we really input the medications that are there for prescribers, like a system via Epic or another health system. So definitely a wide array of opportunities for pharmacists. So with my community background, I love to kind of talk about why community pharmacy is also really important in terms of a career and patient care. So as we kind of discussed a little bit earlier, it's often the first stop for patient questions, because it's really easy to get to a pharmacy. They might already be there to pick up something else. Maybe it's an over-the-counter allergy medication, or for their photo order. So because they're already there, hey, let me go talk to the pharmacist about something. Also, being able to kind of be personal, knowing that they can kind of talk to a pharmacist. If they're already using that pharmacy for prescription drugs, their system, their medical information is already in the system with the medications that they're taking. So being able to have personal interactions in the community setting has also been a big part of what drives that care. Also, during each interaction in the community setting, it allows pharmacists the opportunity to really impact patients. Looking back on my own career, a lot of what really truly impacted me and that I continue to remember along my career are those moments where I've interacted with patients and been able to kind of guide them in terms of either recommending a preventative service or helping answer questions when they were unsure of where to go. So community pharmacists really play a huge role in everyday healthcare, and it's about building those relationships so that patients trust you and are comfortable enough to come with all of their questions. So as you kind of look at opportunities to launch your career in pharmacy, wanted to kind of discuss a couple of different pathways to kind of get out there and get some hands-on experience. And I think one of the biggest recommendations that I can ever offer to someone who's interested in pursuing pharmacy is getting out there, getting exposed so that you can kind of see if it's something that you do want to do long term. So, a couple entry positions in terms of pharmacy, getting into the pharmacy. We have our pharmacy technician roles. So, our pharmacy technicians, this is going to give you hands on experience. You get exposure with working with medications, supporting the pharmacist. So, that could be prescription entry, helping fulfill the prescriptions, assisting patients, and really kind of gives you some exposure. And it can differ according to state regulations. Many of them, you just need to be 18, have a high school degree in order to start out as a pharmacy technician. Certain states will even let you start a little bit sooner at 16 and you don't need a high school degree yet. That kind of gives you a point of entry into pharmacy. We also have then, as you progress, the certified pharmacy technician role. So this is where you're really kind of diving further into your pharmacy knowledge. And this is where then you take an actual exam where you're going to be tested on your problem solving skills, a little bit more about pharmacy related information that'll give you your certification. And many companies will help you actually obtain that certification. So, Walgreens, for example, to become a pharmacy technician, you don't need prior pharmacy experience. And then, as you're working with us in the pharmacy technician role, we can help you become a certified pharmacy tech. We'll offer our own courses where we help you prepare for that upcoming exam, where you can then obtain your certification. So wanted to kind of give a support that program that we also have in terms of technicians that kind of join our team and are interested in becoming a pharmacist. We know that sometimes there are financial barriers to being able to do so, where we'll have team members that really do love what they do in the pharmacy and they want to continue that and become a pharmacist themselves. And to help with some of the financial barriers that could prevent team members from becoming a pharmacist, we newly launched our PharmStart program. So this helps our eligible team members that are working with us full time by giving them access to online pre-pharmacy courses where Walgreens is actually covering the cost for those prereqs that you would need for pharmacy school. So we're covering that tuition and fee, the fees associated with it. And then our team members are paying taxes only on the cost over $5,250. And they're online courses that are really specifically tailored to meet those prereqs for most colleges of pharmacy and what they would require in order for you to begin that PharmD program. And with our partner Guild, who runs the program, there's also one-on-one support with application assistance, really looking at coaching and career services along the program as well. So this kind of gives you a little bit of a clear snapshot in terms of some of the pathways to becoming a potential pharmacist if you kind of wanted to get a feel for it at first. So we have some team members who who start even before they're able to become a pharmacy technician. So let's say they're still in high school, haven't met that state requirement to be able to become a technician yet. Sometimes they're working our front end stores as a customer service associate, and they're still getting to kind of see what the pharmacy looks like from a little bit of a distance, but getting to kind of see what the pharmacy looks like and still in that pharmacy type environment. Then we have team members who go into the pharmacy customer service associate. That's really going to be that entry point to our pharmacies, helping patients in terms of locating over the counter products, also checking out for prescriptions. Then we also have where those pharmacy customer service associates sometimes go to a tech in training, where they're learning to become a technician, or even going directly from our customer service associates to tech in training until they feel comfortable in the pharmacy to become a pharmacy technician. But it's not to say that you necessarily have to start there. We have many that kind of start directly into the pharmacy technician role as well if they're able to meet those requirements. Then something that's maybe a little bit more new in terms of how do you really grow within the pharmacy space if you're starting out as a pharmacy technician or you become a pharmacy technician. Many community pharmacies, hospital type settings will also have a senior pharmacy technician, where now you've kind of been in that pharmacy technician role. You have a strong base knowledge around pharmacy, how to support the teams. You might be a certified technician, and then you become a senior technician where you're really taking on a little bit more responsibility within the pharmacy. And we also have something called our operations manager, which is a pharmacy technician that is leading our pharmacy team. So they're really developing and coaching our total technician team within a particular pharmacy. And our hope is that for our team members that are in these initial roles and want to pursue a PharmD degree, that we're able to kind of get PharmStart in place to help meet those prereqs so that they can get into pharmacy school. Then once you're in pharmacy school, we have the pharmacy intern position. So you do have to be in the professional years of a PharmD program, but when you are in pharmacy school, then you're in a pharmacy intern role where you do a lot of the same responsibilities as a technician, but you're able to support the pharmacist a little bit more. And the further along that you are in the pharmacy program, the more that you can support to your pharmacist. So they might have you kind of working on what we call MTMs, where basically you're looking at patient medication lists, talking to them about are they taking their medication daily as prescribed, and other clinical services within the pharmacy as well. And then we have after graduation, and as you obtain your pharmacist license, switching over to a pharmacist position where now you're really leading that pharmacy team and the community impact along healthcare. So that's how we hope to kind of help support that transition into interest into pursuing a PharmD. So I spoke a little bit about it. If you become a pharmacy technician, let's say you take advantage of a resource like PharmStart to get those prereqs, you get into pharmacy school. Once you're actively enrolled in the professional years of a PharmD program, we'll have you kind of in a pharmacy intern position, and it could be in a hospital setting, would be the same. But even in a community setting as a pharmacy intern, really going to be assisting the pharmacist and helping build those necessary professional and clinical skills to become a pharmacist. So really this role is to help prepare you for that next step of becoming a pharmacist, to get as much hands-on experience in those patient interactions. How do we deliver the best care? How do we make the most impact within our communities? So a really great support system that also continues. So PharmStart might help get you initially started, We hope to support you each step of the way as you hope to become a pharmacist. So another program that we offer is our Pharmacy Education Assistance Program, which at Walgreens we love to call PEAP. And basically, they are monetary awards that you can use for any type of academic expenses, and they're provided along the professional years of the program. So there are some PharmD programs that are going to be 4-year programs versus a 3-year program. So the monetary awards are going to differ slightly upon how that's broken, but the total potential that you can receive is $40,000. So I think that's a great benefit to kind of help support your academic journey as well. The only stipulation to this is that for each year that you take an award, we ask that you stay as a licensed pharmacist with us post-graduation. So if you're in a 4-year program, for each year that you take an award, we ask that you stay for 12 months as a licensed pharmacist, versus if you're in a 3-year program, for 16 months for each year that you take an award. So if you're in a 4-year program, you take the full 40,000. We'll ask that you stay on as a licensed pharmacist for 4 years post-licensure. And we run this application process on a yearly basis. So it starts in the beginning of September, usually beginning to late May, where we can have our pharmacy interns submit an application and then receive the funds from our PEAP program. So now kind of transitioning to help you cross that finish line. So now that you've met the prereqs, you've kind of wrapped up pharmacy school, you're looking to graduate, how do we really help support you as well for a pharmacist position and to help establish that career? So really great support resource that we offer in addition to those PharmStart and PEAP programs is we have a U-World program where we actually provide to our interns that are graduating access to study resources to take the NAPLEX exam, which is pretty much a board exam to obtain your pharmacist license, as well as something that we call the MPJE, which is a state-specific exam for pharmacy laws. And this could change a little bit because some states are kind of changing how they do their law exams. But we will provide those resources to help you pass those licensing exams. Also, really great benefit that we launched within the past couple of years is our student loan 401k program. So we know that as you kind of graduate, you may have student loans that you continue to pay. And when you're paying off those student loans, you might not be able to contribute to a 401k for your retirement, where sometimes you're kind of in a hard place. Do I pay my student loan or do I contribute to a 401k to help set myself up for retirement? Knowing this information, we now have a program where we can take your student loan payments and consider them as if you were making contributions towards a 401k retirement savings program. And Walgreens will actually match eligible loan payments and put it into a 401k for you, up to 4% of eligible pay. So the one caveat to this is that typically you're only eligible for this after you've been with the company for 1 year and have worked at least 1,000 hours. But it's a really great benefit that, let's say you're paying those student loans, Walgreens will treat it as if those were contributions into a 401k and actually put it into the retirement savings plan for you. So now kind of looking at, let's say you're a full-fledged licensed pharmacist and you decide that community pharmacy might be the path that you'd like to explore. And I love to really talk about potential growth that we see in the pharmacy setting in community chains. I myself have kind of explored different roles, but you can go from pharmacy intern into a graduate. We also have residency programs where you can kind of get a little bit more hands-on experience in terms of the community setting. And we have a fellowship as well in executive leadership. But we have pharmacists that do worksite pharmacies, that work in a specialty pharmacy, that maybe are in our micro fulfillment center where they're actually filling prescriptions that could get shipped out to other Walgreens pharmacies or a centralized call center. And then team members that actually grow into larger support center roles where they're helping kind of deliver information and programs to our teams in our stores. So this just gives you a little bit of a snapshot in terms of a multitude of different roles that our pharmacists go into. And there's really pharmacists in every part of the company. So besides our community pharmacists, we'll also have pharmacists that go into field leadership roles where they're now leading our pharmacy teams, or they'll go into corporate clinical services, public policy and government affairs, and different types of roles that you wouldn't think of in a pharmacy setting. So really kind of just to summarize, the role of the pharmacist is continuously expanding. You're not just dispensing medications, you're really improving access to care within the community setting and showing up for communities that really rely on us to help deliver care. So we're hoping that you decide to pursue a pharmacy degree, and if you do, that we are here to help support you along the way. So I know that was a bit of information, and I'd love to kind of hear from anyone that may have questions. But I really thoroughly enjoyed being able to kind of speak a little bit more about community pharmacy.
Thank you so much for this wonderful presentation. Really so informative and appreciate all your guidance. And we want to thank our participants for attending the session. The expo is just about to open, so we do invite you, if you have any questions that you wanted to bring up, please stop by the booth to be able to talk with our speaker. Again, that speaker the expo does open from 5 to 7 p.m. Eastern today. You'll be able to answer and ask any questions. But please, I hope you all join me in thanking our speaker today for this excellent presentation, for time and insights, and we hope that you enjoy the rest of this fair. Thank you.
Thank you.